Hello family, how's everybody doing today? Welcome again to Amazing Growth. My name is Antoinette Hunter. I am a teacher and a developmental intervention specialist. Just letting you know if this is your first time watching my video. On today's video, I am going to continue with the topic of Asperger syndrome, but I am going to give you guys information on the treatment that your child would need if or when diagnosed with Asperger syndrome. It's a type of autism, okay? It's under the spectrum of autism, even though a lot of kids with Asperger syndrome perform above average and they can do very well communicating, but there are other things that they need to help them to be able to function on their daily basis. So I'm going to give you guys the strategies and technique, but just want you guys to understand that every child is different. There isn't any one size fits all approach. Your doctor might need to try a few therapies to find out which one is best when or if they're diagnosed with autism spectrum disorder, which is Asperger syndrome, as one of the disabilities on the spectrum. I know you're very interested in finding out the treatment. Does it work? Yes, it does work, but you have to be consistent with the treatment. And the first one is social skills training. In a group or one-on-one sessions, the therapist teach your child how to interact with others and express themselves in a more appropriate way. Social skills are often best learned by modeling after typical behavior. So after a typical behavior, you want to model that skills that you want the child to perform during therapy. That's what the therapist is going to be there for, to help assist and give your child that technique and strategies that the child needs by modeling it to them. The next one would be the speech language therapy. This helps improve your child communication skills. For example, they'll learn to use a normal up and down pattern when they speak rather than a flat tone. So the speech therapist is going to help them to communicate and engage in a back and forth conversation. They'll also get a lesson on how to keep up a two-way conversation and understand social cues like hand gestures, more, give me, help, and many others. And also it's going to help them to maintain and keep an eye contact when they're having a conversation with another person, or probably sitting in the classroom, okay, or just function in different settings. Another one is the cognitive behavior therapy, which is the CBT. It helps your child change their ways of thinking so they can better control their emotions and repetitive behaviors. So they'll be able to get a handle on things like outbursts, meltdown, and obsessions. All of these therapies are very important for your child, so do not take any one of them lightly. Whenever you have a therapy come into your home to assist your child or work with your child, you want to be present so that way you can learn some of the techniques and strategies that the therapist is using to work with your child, so that way you can use what the therapy is doing at home as well, okay, with them when they're not present. Remember, sometimes they're only there maybe for 45 minutes, 1 hour, 90 minutes, maybe 2 hours, but you are the one that's there with that child on a daily basis. So you want to make sure you're involved and you want to learn that engagement on how to get them to interact and in joint attention play with you, so that way you can increase their communication skills and help them to function better in society. You know, parents' education training is important. Education is for me, I believe that education is not the ability for you to have degrees. is to educate your child or educate yourself on a particular skills that you need. For example, you know you're having a child with autism, educate yourself on the condition, and also watch videos, read research, what research is saying, engage during therapeutic session. You learn many of the same techniques your child is taught, so you can work on social skills with your child at home. Sometimes I kind of encourage some families to seek counselor to help them deal with the challenges of living with someone with Asperger syndrome, because I know that it can be very challenging, and that's the reason why I am here to support you to the best of my ability and encourage you that if you have to go and get a counselor to assist you, do so. Talk to your therapist. Ask them questions. If you have any problem, reach out to them to see if they can help you. Don't be quiet. Don't deal with it by yourself, because sometimes it can be overwhelming. I'm saying that because I work in the classroom with children, and I also work with kids on a daily basis, working with them one-on-one and in a clinical setting. So I understand the overwhelming feeling that a lot of families are going through. So I am here to encourage you that you are not alone. I am here to support you because I love when I serve people. I love to serve people. And I love to see families happy and children improving. Another one is applied behavior analysis. It's a technique that encourages positive social and communication skills in your child and discourage behavior you rather not want to see. The therapist will use praise or other positive reinforcement to get results. I use that a lot. I am a developmental intervention specialist, a DI in the field. I do believe in praise and using positive reinforcement to get results. But again, remember, every child is different, so you want to find that reinforcement that will make that child really get excited and want to give you what you want. They want to give you what you want to see, and also help to improve the child growth. Medicine or medications. There aren't any drugs approved by the FDA that specifically treat Asperger or autism spectrum disorder. That's what research is saying for now. But some medications can help with related symptoms like depression and anxiety. Your doctor might prescribe some of those the medications of anxiety and depression. Personally, I think that's your personal decision to make in terms of you trying to get medications for your child. I am not here to tell you to go and get medication, but I can only encourage you that if you're having any kind of difficulties, talk to your doctor, discuss the best options with your doctor, sit with your family, pray about it, and make the decision. Before you make a decision, always make sure you pray. Thank you guys so much for watching this video. Have a great day. God bless you. Goodbye.